ask on schools. You suggested yesterday that potentially some pupils might or could return in June. Some criticism that you might have caused some confusion yesterday. Do you accept that or not?
Well, I don't, actually, because I think the confusion was caused by the way what I said was reported rather than by what I actually said. So, Owain, thank you. I'll repeat what I actually said yesterday here, which is that it takes 3 weeks from the moment you make a decision to reopen schools for schools to be reopened. So if we were to have decided today, the earliest schools could have reopened would have been June. I didn't say that that's what we were doing. I just reflected the advice we've had from teacher unions and others about the length of time it takes to implement a decision of that sort. So had we decided today, it wouldn't be until June. Whenever we decide, it will take 3 weeks from making the decision to a school being able to reopen. Diolch yn fawr. Adam Hale of the Press Association.
Thank you, First Minister. On schools, again, NHS England's National Medical Director, Professor Stephen Powis, said that the science is still on how much children contribute to the spread of the virus. So what's your current understanding of the science relating to that, and how is that feeding into your considerations about the reopenings of schools?
So the science we saw in the very beginning, Adam, said that this is not a virus that has, in general, its most significant effects on younger people. So children are not in the very front line of coronavirus. It attacks older people and people with underlying health conditions. But the science is less clear on the role of young people in spreading the virus. And work still goes on that, and it's work that goes on around the globe to try to understand the part that children might play in that way. We get reports on the emerging evidence on that, both from our Chief Medical Officer and from the person who represents us at the Scientific Advisory Group. And you know, I still don't think that across the world there is a settled understanding of the role of children in the spread of the virus, but we are learning new things every day. And as I say, in Wales, we are trying to learn, not just from our own experience or even the UK experience, we're trying to make sure we have access to learning that's going on around the globe.
Thank you. And returning again to this issue of this app that's being trialled in Isle of Wight, our Chief Medical Officer said that he believes the public could be willing to part with some personal freedoms when it comes to using this app. Do you agree that the Welsh public would and should be willing to part with such freedoms to help tackle the spread?
Well, my answer, I think, would be a conditional yes. I think people in Wales have always demonstrated a willingness to act collectively, to do things in our own lives that have a benefit for others. And that, in a way, is what the app is designed to do. It's designed to draw together all our experiences and allow each one of us to make better decisions as a result. So I think there will be a predisposition by people in Wales to take part. But the condition is that issues of personal data have been thought about, that there are protections in the system, that there's a statement published alongside the app that explains to people how the information they are voluntarily contributing will be used, and that you know that it wouldn't be used in ways and for reasons that you wouldn't be willing to support. So long as it's done properly and we're able to explain to people the safeguards that are there, my inkling would be that people in Wales will be willing to use it and will do it as people in Wales do, not because they're thinking of themselves, but because they're thinking of how something they might do would be of benefit to other people. Mark Hutchins, 5 lines.
Thank you, First Minister. If I can just expand on Felicity's question about the return to work. Wales TUC have just told me that they've looked at the draft guidelines from the UK government and they think they would put people's health at risk as proposed. Do you share those concerns, and what beyond the 2-metre rule would the Welsh Government do to protect people's health and to ensure that unscrupulous employers don't take advantage?
Well, what I've seen of the documents that the UK circulated over the weekend, I think their limitation is not that they would cause active harm to people's health, but they are pitched very generally. And what we will have to do in Wales is to translate the general advice they give into much more specific action in different workplaces, because workplaces vary enormously, and what you need to be able to do to make one place safe will not be identical to what will be needed in a different sort of setting. And that's why we've been working on this over the last 10 days or more, involving trade unions, involving employer associations. Very good help, for example, from organisations like the Wales Automotive Forum. And that is about customising the general advice so that it works in the specifics of a workplace. Now, social distancing will be part of that, but there are many other measures that employers will want to think about. They'll be wanting to think about places where people gather in the workplace, canteens, for example, and how you would use those in future. They will be wanting to think about hours of work, to extend the hours of work so there are fewer people there at any one time. Do you have different shift patterns so you'd have fewer people in the building? What can you learn from the experience of the last 6 weeks, where we know that lots of people are successfully able to work at home for much longer periods than was the case before? So there's a wide repertoire of ideas that can be drawn on. What then has to happen is that those ideas have to be applied, and there needs to be a plan, and each employer, I think, will be required to publish a risk assessment that shows how they translated the general advice into things that give their workers confidence that this is a safe place to which you can return.
And for all the discussion about the return to work, obviously that doesn't apply to the over 70s. Is there any optimism you can offer? What can you say to the over 70s, many of whom may be fitter than you or I am, about what the earliest is that they could see their lives opening up?
Well, I don't want to offer people false optimism about how quickly people will begin to see that difference. My view has long now been that the early stages of moving out of lockdown will not look very different to lockdown itself. That those first measures need to be careful, they need to be cautious, and they need to be capable of being monitored carefully as well, to make sure that if there are any unintended consequences, we can deal with them quickly. And I know that 70 is a blunt instrument, and that there are people beyond that age who are very healthy and very capable, but this virus does attack disproportionately people who are older and people with underlying health conditions. And the older you are, the more likely you are to have such an underlying condition, even if you are feeling perfectly fit and well. So the reason we've given that advice to people in that age bracket is not because we wanted arbitrarily to make their lives more difficult, but because we know that that population is at greater risk, and it makes sense for people in that age bracket, therefore, to take greater precautions. Mark, thank you. I'll go to Mike Hughes from Global.
Thank you, First Minister. Reopening the economy and schools is one thing. Rebuilding people's confidence is another matter. As the discussion around opening schools starts, what do you say to parents who could be reluctant to send their child back to school? And could parents see repercussions if they're told to send their child back to school and feel it's in their son or daughter's best interest not to do so?
Well, my message to parents of children in Wales is that we will not be reopening schools until we are satisfied that we are able to do so in a way that protects your child's health and well-being. So there will be no rush to reopen schools in Wales as they were just before and after Christmas. When we do come to reopen schools, it will be done in a careful and measured way, where new safeguards are built into the system, where we have discussed the way in which schools can run with local education authorities and with teachers themselves. And we will not be asking you to send your child to school until we are confident that we can say to you that we have thought about those things and put those measures in place. And then I am not attracted to the idea of compulsion as the way to persuade people of this. I think we will need to move by persuasion, to be able to demonstrate to people that we have done the right things, that their child will be safe, to persuade them of that. And then I think we will succeed in bringing parents and pupils along with us.
Thank you. You've repeatedly defended your strategy on testing, particularly in care homes. But what do you say to care home staff who are worried that they could be asymptomatic, but because they're not displaying symptoms, they feel they cannot get a test? And you've said that testing all care home staff would be a pull on the limited resources that you have at the moment. But if capacity can be accelerated in England, why has increasing capacity been such an issue in Wales?
Well, we have increasing capacity in Wales. We've increased capacity week by week. We had more people being tested over this weekend than ever before. And we've extended testing in care homes as well. Asymptomatic staff are being tested in care homes in Wales where there is somebody who is known to be suffering from coronavirus. And what we do in Wales is we follow the advice we are given. And that advice does change over time as we learn more about the virus and about where our efforts are best concentrated. So we said at the end of last week we will be doing more testing in care homes, in large care homes, in care homes where there are new outbreaks. The Chief Medical Officer said today that the key things for us in relation to care homes and care home staff is to prevent outbreaks of coronavirus in those homes where there isn't any today, and to do more to respond to care homes where coronavirus is in circulation. That sounds to me like a very sensible, planned way of doing things, and we will act on that advice. Off to Mark Smith of Wales Online.
Thank you very much, First Minister. I understand that some COVID-19 patients who have recovered from the virus after being in intensive care will need regular checkups for the next 6 months or so. How will the NHS be able to cope with all these additional appointments at a time where routine, non-urgent appointments and procedures are likely to have started up again?
Well, Mark, thank you for that, and that's an important point, and it is one of the things we are learning about the virus, that some people who recover, that the recovery period is an extended period and that they need continuing contact and advice with the health service. It's why we have invested so much and so rapidly during the time of the disease in remote consultations. So your GP now is able to see you by video link, not simply face-to-face, where advice can be given and monitoring can take place in that remote way. And we've extended all of that now, not just to GP surgeries, but to outpatient appointments as well. So the health service is learning a lot during coronavirus. And some of the things we will learn will be positive lessons that we can take into the future, and being able to keep in contact with and to monitor the recovery of those people who need ongoing advice and contact with the health service will benefit from the investment that we have made and the incredibly rapid way in which clinical practice has adapted to deal with the circumstances the coronavirus has created.
Thank you very much. And secondly, I wanted to touch on the role of agency staff here. So I wondered how much has the Welsh NHS had to rely on agency doctors and nurses to boost the numbers. I understand that agency nurses have been drafted in from as far afield as Brighton to help out in Wales.
Well, we've always made use of agency staff in the NHS in Wales, and they're an important part of the way that the health service copes with unexpected demands or absence because of illness, or it's sometimes planned absences where clinicians go off for training and so on. But the primary new sources of assistance that we have mobilised in Wales has been from that fantastic response from retired doctors, retired nurses, retired physiotherapists and so on, who've come back to work in the NHS to help us through the crisis. And the use we've been able to make of medical students completing their training, nurses who are going through the training process. The bulk of the extra help that we have secured has been from those new sources of help, while agency staff continue to play, as they always have, the valued part that they play in the health service. Mark, thank you. I'll go to Rob Taylor of Wrexham.com.
You've said that England is not the touchstone, and the Chief Medical Officer said that observing what countries around the world do is key. What makes Wales different to the likes of Spain, Italy and others regarding face mask advice? And is the preparation work taking place now to have stock to supply the population with masks if that is required?
I've been in discussion with the Chief Medical Officer this morning, in fact, on the subject of masks, and he is going to formalise his advice to the Welsh Government on the pros and cons of. I want to be really clear about this. What we are talking about are not masks of the sort that are used in hospital. We will not go down the line, and neither have they in Scotland, and neither was the Prime Minister when he talked about this at the end of last week. We're not going to embark on a course of action where members of the public end up competing with the health service for the use of masks, which are needed in a clinical setting and for which there isn't evidence for use in the community. What we are talking about are non-clinical face coverings. That's the phrase the Scottish Government has used in its guidance. We will get formal advice now from the Chief Medical Officer in Wales about the pros and cons of making use of non-clinical face coverings advisory here in Wales.
The Economy Minister has pointed to the deep pockets of UK government and the intervention that might be required from them to help Airbus, which is obviously the large employer in North East Wales, let alone the wider supply chains. Do you agree with that? And have you lobbied UK government to intervene? And if so, what feedback have you had?
Well, I definitely do agree with that. There is a global crisis in the aerospace industry. It affects not just North Wales and Broughton, it affects Airbus right across the globe. And while we continue to work closely with the company and to do the practical things that we can do in a Welsh context, and Rob, I know you will know that the Advanced Manufacturing Centre on the campus of Broughton was paid for with £20 million worth of Welsh Government investment. We put that there in order to help Airbus go on being a successful global company into the future. But in a global crisis, it is the UK government that has to step into that space, as it does in the steel industry. And of course we have those discussions with the UK government. Ken Skates will have been talking to UK ministers last week, as I know he is again today, and we make the case for the sort of long-term investment that will be necessary to help those highly successful companies like Airbus to get through the crisis and therefore to be there afterwards to go on providing the sorts of incredibly valuable jobs that they provide as part of the economy of North East Wales. And finally, on my list, to Tom Magna of Carers World Radio.
Thank you, First Minister, and good afternoon. When educational establishments go back, how will you ensure that care agencies giving vital support to young carers in the family home are ready as well to match the young carers' return to school, college or university?
Well, Tom, thank you very much for that. Young carers are a really important part of the landscape here in Wales, and we've worked over many years to make sure that schools are sensitive to the needs of young people who, as well as completing their education, are carrying out vitally important work inside the home, looking after other people, sometimes from a very young age. And I hope it is fair to say that a decade and more after we first began to talk about this issue, that schools are in a different place than they were back then, much more likely to know about that young person's circumstances and to help them to combine the responsibilities they discharge at home with everything that they need to do in school. And having young carers organisations outside school where those young people can come together, share experiences, get support from one another, know that there are other adults in their lives that they can talk to and gain advice is another very important part of the landscape of services we put in place in Wales. My colleague Julie Morgan, the Social Services Minister, works with Kirsty Williams, our Education Minister, on these matters. We're providing guidance and advice to our colleagues out there in the field who do that important work, and we will certainly have the needs of young carers in our mind when, and it's not now, but when we move to open schools again, to make sure that their needs are not overlooked or neglected as we move back into that world.
And to what extent does that same message apply to colleges and universities? Because after all, young carers are across all ages.
Well, they certainly are, Tom, and we have slightly different arrangements in colleges, further education colleges and universities. Universities in Wales often have their own arrangements in which they make sure that young carers have the help they need, the equipment they sometimes need, the extra support they require to balance the demands at home and in university. Our further education colleges are more aligned with the services that we provide through schools and through young carer organisations, just as we will have our eye on this issue in the school context. I want to give you and the young people who rely on those services an assurance that their needs will be firmly in our thinking and in the discussions we have with higher, further education and in the school sector as well. There we are.